If you've been prescribed amlodipine, better known by the brand Norvasc, you've probably wondered two things right away. Why does it make ankles swell for some people, and what's the deal with the interaction warnings, especially when you're already on other heart or blood pressure meds? This is educational only and meant to translate the label into plain English. I'm not a clinician, and I'm not telling you to start, stop, or change anything. For personal medication decisions, side effects, or interaction questions, your doctor or pharmacist is the right person to loop in. Amlodipine is a long-acting blood pressure and heart medicine that was developed by Pfizer's research team in Sandwich, England, with patent filings dating back to 1982, and it later became a major product under the name Norvasc. In the US, the label for Norvasc lists initial approval in 1992. Amlodipine is a calcium channel blocker, specifically the dihydropyridine type. That sounds technical, but here's the simple picture. Your blood vessels have muscle in their walls. That muscle tightens and relaxes all day long to control pressure and blood flow. Calcium is one of the signals those muscle cells use to squeeze. Amlodipine reduces how much calcium gets into those vessel wall muscle cells so the vessels relax more easily. When the blood vessels relax, blood pressure tends to come down. And for people with certain kinds of chest pain, that relaxed vessel effect can also improve blood flow to the heart muscle. On the official label, amlodipine is used for high blood pressure and for coronary artery disease, including certain angina situations. You might also hear it mentioned for things like Raynaud's, cold, color-changing fingers and toes, and it is sometimes used that way in real-world practice, but that's a clinician decides based on the person's situation, not a blanket endorsement. Now let's get into what people actually feel, because this is where most of the anxiety comes from. The most common, most complained about side effect is swelling, usually in the ankles or feet. People often describe it like, my socks leave deep marks, or my shoes feel tighter by evening. That swelling is usually not a water weight thing like a diuretic situation. It's more about how amlodipine changes blood flow in small vessels, which can let fluid collect in tissues in some people. Other common things people notice include flushing, headache, feeling tired, dizziness, and sometimes palpitations, or a sense that the heartbeat feels more noticeable. Some people feel totally fine. Others feel a little floaty the first week or two, especially if their blood pressure drops more than they expected. Less common but important side effects are the ones that feel more serious or more disruptive. Fainting, severe lightheadedness, or symptoms that feel like your blood pressure is dropping too low are reasons to contact a clinician quickly. There's also a label note that in some people with severe coronary disease, angina can worsen or a heart attack can occur when starting or increasing certain blood pressure medicines. That's uncommon, but it's part of why clinicians take chest pain changes seriously. So the red flag version is pretty simple. If you have new or worsening chest pain, fainting, severe shortness of breath, or swelling that's suddenly severe or paired with feeling very unwell, that's not a wait and see for a week moment. Contact a clinician urgently, and if it feels severe or escalating, seek urgent medical care. Now the interaction section, because this is where people get tripped up. Amlodipine is usually not the most interaction-heavy drug on earth, but a few categories matter a lot. Alcohol can amplify dizziness and lightheadedness, especially if your blood pressure is already coming down. It doesn't mean alcohol automatically causes a crisis. It means the combo can make you feel more off balance than expected. Other blood pressure meds can stack the blood pressure lowering effect. That can be totally intentional and beneficial when managed well, but it's the reason people sometimes feel woozy when multiple meds overlap. This is especially worth double-checking if someone is also taking meds that can affect heart rate or cause dizziness on their own. A big label-level interaction to know about is simvastatin. When amlodipine is taken with simvastatin levels can rise, which increases muscle injury risk. So the label limits simvastatin to 20 mg daily when used with amlodipine. This one is classic pharmacist catch because it's easy to miss if you've been on both meds for a while. Amlodipine is also affected by meds that change the liver enzyme system called CYP3A4. If you take certain strong or moderate CYP3A4 inhibitors, amlodipine exposure can increase, which can mean more swelling or low blood pressure symptoms in some people. Examples clinicians often think about include certain antibiotics and antifungals and some HIV or hepatitis drugs, but the exact list is long and changes over time. So this is exactly where a pharmacist earns their pay. On the flip side, some CYP3A4 inducers can potentially reduce how much amlodipine is in the system, which can matter for blood pressure control. OTC meds people forget about. This one's sneaky because the interaction isn't always a direct drug A plus drug B equals danger. Sometimes it's just that OTC products can push blood pressure up or make you feel off. Decongestants and some cold medicines can raise blood pressure in some people. NSAIDs like ibuprofen and naproxen can also raise blood pressure for some people, especially with regular use. So if someone's blood pressure suddenly looks worse and nothing else changed, that OTC corner is worth reviewing with a clinician. Supplements and everyday substances. Grapefruit gets mentioned a lot with calcium channel blockers because it can affect CYP3A4 metabolism in the gut for certain drugs. With amlodipine, the impact may be modest for many people, but if you drink grapefruit juice regularly, it's still a smart double-check item, especially if you're getting more swelling or dizziness than expected. Procedures and anesthesia. This isn't a dramatic warning, but it's a practical one. If you're having surgery or a procedure, the team should know your full medication list because blood pressure and fluid status matter during anesthesia and recovery. Amlodipine is common enough that they've seen it a million times, but they still need it on the list. So what's the bottom line? Amlodipine, also known as Norvasc, is a calcium channel blocker used for high blood pressure and certain heart-related chest pain conditions. It works by relaxing blood vessels, which lowers pressure and improves blood flow. The most common side effect people notice is ankle or foot swelling, and the biggest practical risks are feeling too dizzy or faint if blood pressure drops too much, especially when other meds or alcohol stack the effect. Interaction-wise, the big themes are stacking blood pressure lowering with other heart meds, watching the simvastatin limit if you're on that statin, and double-checking CYP3A4 inhibitor medications that can raise amlodipine levels and make swelling or hypotension more likely. If you want 3 solid questions to ask your doctor or pharmacist, these usually get real answers fast. Is ankle swelling from amlodipine something you expect in my case, and what should I watch for that would be more concerning? Do any of my other meds, especially simvastatin or certain antibiotics or antifungals, change amlodipine levels enough to matter? Are there any OTC cold medicines, pain relievers, or supplements in my routine that could mess with blood pressure control or make dizziness worse? That's Med Label Translator. No hype, no panic, just the label translated into normal language.